On this day 2 years ago, they had to queue to get into Glasgow Airport's COVID test centre. Today, it was deserted. Test sites will begin packing up this weekend as the focus of this pandemic response shifts. Inside this envelope is antiviral medication. A mother has arrived to collect it for her daughter, who is immunocompromised. As more treatments have become available, this centre based at Hairmyres Hospital has expanded to help high-risk patients deal with their COVID symptoms at home.
We explain to them that we offer 3 different types of treatment. It just is very person-centred, depending on your conditions, what kind of medication you're on. And if it is for the IV infusion, you're only in for a couple of hours in your home. You're not in all day, so we explain to them it's only a few hours if you do need to come in for it. But we can obviously offer you oral medication if you'd rather.
One of the patients given this option in recent weeks was Michael Flynn. The former US Marine and martial arts teacher was on the shielding list due to chronic lymphatic leukemia. He called staff the morning he found out he tested positive for COVID.
So then 3 hours later, this guy chaps the door and he's got this dose of medication, a 5-day dose of medication. Shortly after the 3rd dose on Wednesday morning, I was fine. I just felt brand new.
Not everyone on the shielding list meets the criteria for antiviral medication, a situation groups including Parkinson's UK say must be addressed. Here, staff believe efforts so far have been helping to reduce hospital admissions.
Around about 1,300 patients have been through the assessment pathway. 800 patients have received treatment. So looking at the data, that has most likely prevented serious illness, hospital admissions or death in around 70 to 80 patients.
After more than 2 years of being on an emergency footing, this status will lift for the NHS in Scotland at the weekend. But despite a fall in COVID cases, huge pressures remain on the workforce as they deal with capacity issues and demands for urgent care. From Sunday, there will be no requirement to self-isolate. Instead, anyone with COVID symptoms, such as a fever, will be urged to stay at home until they feel better. PCR tests are no longer advised and all contact tracing will end. Testing will remain available to certain groups, including healthcare staff, hospital patients and care home visitors.
We are living with COVID, and in fact we have been for some time, but we're now living alongside the virus, but we're managing the virus. That's really the key phrase. Now the scientists are still looking very carefully at new variants. We're also doing clinical research around new treatments, and we're rolling out the treatments that we have. So that is not stopping. And we may need to step up our response in future.
For now, the downward trend continues. Last week, 1 in 25 people were infected with COVID. These sites may disappear in the coming days, but the virus itself is far from gone. Sharon Frew, STV News.